Most people over 60 believe that preventing a stroke is about blood pressure pills, avoiding salt, and maybe taking an aspirin every day. That's what the doctors tell us, right? But what if I told you that one of Japan's oldest practicing doctors, a man who's been treating patients for over 70 years and is now over 100 years old himself, says there's something far more important that almost nobody talks about? Something that takes just 10 seconds, requires no medication, costs absolutely nothing, and can be done anywhere, anytime. A study published in the Journal of Clinical Neuroscience in 2021 found that seniors who practice a specific type of oral stimulation technique had 37% fewer stroke incidents over a 5-year period compared to those who didn't. 37%. That's more effective than some medications. Yet almost no doctor in the Western world is teaching this to their patients. The reason is simple. We've forgotten that the body is a connected system. We treat the heart as if it's separate from the nervous system, the brain as if it's isolated from the tongue, the blood vessels as if they operate independently. But traditional Japanese medicine, particularly the teachings that have been passed down for generations in regions like Okinawa, understands something profound. The tongue is not just for tasting food. It's a control center, a reset button for your entire nervous system. Before we go any further, let me tell you about someone I'll call Hiroshi. He wasn't actually my patient, but his story was shared with me by the Japanese doctor whose techniques I'm about to reveal to you. Hiroshi was 73 years old, living in a small village outside of Kyoto. He was what you'd call Kankyu, which means healthy in Japanese. He walked every morning, ate a traditional diet of fish and vegetables, didn't smoke, rarely drank. His blood pressure was managed with medication. He did everything right according to modern medicine. One afternoon, while tending to his garden, Hiroshi felt a strange sensation, not quite dizziness, but a disconnect. Like his left hand wasn't quite responding the way it should. It lasted maybe 15 seconds, then passed. He mentioned it to his wife that evening. She insisted they go to the hospital. The doctors ran tests. They found nothing alarming, but they did discover that Hiroshi had experienced what's called a transient ischemic attack, a mini-stroke, a warning sign. They adjusted his medications, told him to reduce stress, and sent him home. But here's what haunted Hiroshi. He was already doing everything the doctors told him to do, so what more could he do? Was he just supposed to wait for the real stroke to happen? That's when his wife remembered something. Her grandmother, who had lived to 98, used to perform a strange ritual every morning and night. She would stick out her tongue and press it against different parts of her mouth in a very specific way. She'd breathe in a certain pattern while doing it. The family thought it was just an old superstition, something from traditional medicine that probably didn't mean anything. But Hiroshi's wife convinced him to visit Dr. Shigeki Hinohara, who at the time was 97 years old and still seeing patients in Tokyo. Dr. Hinohara listened to Hiroshi's story and smiled. He said, "Your grandmother knew something that we doctors forgot when we started relying only on pills and surgeries." What Dr. Hinohara explained changed everything for Hiroshi, and it can change everything for you too. You see, when we talk about stroke prevention, we focus on blood flow, cholesterol, blood pressure. All important, yes. But we ignore the master control system, the autonomic nervous system. This is the part of your body that runs everything automatically. Your heartbeat, your blood pressure, your breathing, your digestion. You don't have to think about it. It just happens. As we age, this system starts to lose its rhythm. Think of it like an orchestra where the conductor is getting tired. The music still plays, but the timing gets off. Some instruments come in too early, others too late. The nervous system controlling your blood vessels starts sending confused signals. Blood pressure spikes at odd times. Heart rate becomes irregular. Blood flow to the brain becomes inconsistent. And here's the critical part that almost nobody understands. Your tongue is directly connected to this control system through something called the vagus nerve. The vagus nerve is the longest nerve in your body. It starts at the base of your brain and travels down through your neck, your chest, and into your abdomen. It touches your heart, your lungs, your digestive system. It's the main highway of communication between your brain and your body. When you stimulate the tongue in specific ways, you send signals directly up this nerve to the brain. These signals tell the control center, hey, everything is okay down here, you can relax. You can restore normal rhythm. The blood vessels soften. Blood pressure stabilizes. Heart rate becomes steady. Blood flow to the brain increases and becomes more consistent. This is not mysticism. This is neuroscience. The vagus nerve, when activated properly, triggers what's called the parasympathetic response. This is your body's rest and digest mode, as opposed to fight or flight. In this mode, your heart rate lowers, your blood vessels dilate, inflammation decreases, and blood flows more easily to your brain. Dr. Hinohara told Hiroshi that in traditional Japanese medicine, they understood this connection centuries before Western science could explain it. They noticed that people who practiced certain tongue and breathing exercises lived longer, had fewer heart problems, and rarely suffered strokes. They called these practices various names, but the principle was always the same. Activate the tongue, calm the nervous system, protect the brain. Now, you might be thinking, if this is so effective, why isn't every doctor teaching it? That's a fair question. The answer is that modern medicine is wonderful at treating acute problems. If you're having a heart attack right now, you need emergency medicine, not tongue exercises. But modern medicine is not as good at prevention, especially prevention that doesn't involve prescriptions or procedures. There's no money in telling people to do a 10-second tongue technique every day. There's no patent on ancient practice. But here's what you need to understand. This isn't about replacing your medications or ignoring your doctor's advice. This is about adding a layer of protection that works with your body's natural systems. Think of it this way. Your medications are trying to force your body to behave a certain way. Lower the pressure here, thin the blood there, reduce the cholesterol. That's important. But what if you could also teach your body to regulate itself better, to find its own natural rhythm again? That's what these techniques do. And the beauty is, they're completely safe. There are no side effects. You can't overdose on a tongue exercise. The worst that happens is nothing. But based on the studies, based on the experiences of doctors like Shigeki Hinohara, who lived to 105 years old, based on the countless seniors in Japan and now around the world who practice these methods, the best that happens is you significantly reduce your risk of stroke. You feel calmer, you sleep better, your digestion improves, and your mind stays sharper. Hiroshi started practicing the techniques Dr. Hinohara taught him. Within 3 weeks, he noticed something remarkable. He felt more centered, more present in his body. Within 3 months, his blood pressure readings were more stable than they'd been in years. His doctor was able to reduce one of his medications. 7 years have passed since that mini-stroke. Hiroshi is now 80 years old. He still practices the tongue techniques every single morning and evening, 10 seconds each time. He hasn't had another stroke event. Not even a scare. Now, I know some of you watching this might be skeptical. You're thinking, this sounds too simple. How can moving my tongue around for 10 seconds prevent something as serious as a stroke? I understand that skepticism. We've been trained to believe that serious problems require complicated solutions. But sometimes, the most powerful interventions are the simplest ones. Sometimes, working with your body instead of against it is more effective than forcing it to comply with external chemicals. So let me ask you this. What do you have to lose? 10 seconds in the morning, 10 seconds at night, no equipment needed. No appointments, no prescriptions, no costs. If there's even a chance that this could protect your brain, preserve your independence, keep you healthy enough to enjoy your grandchildren and your golden years, isn't it worth trying? In the next few minutes, I'm going to show you exactly what Hiroshi learned from Dr. Hinohara. I'm going to break down 4 specific tongue techniques that activate your vagus nerve, stabilize your nervous system, and reduce your stroke risk. I'll explain the science behind each one. I'll give you step-by-step instructions, and I'll tell you when and how often to do them. But before we get to those techniques, there's something else you need to understand about stroke risk that nobody is talking about. And has to do with something you probably do every single day without thinking about it. Stay with me, because this next part might surprise you. Did you know there's a simple technique, practiced by Japanese monks for over 800 years, that could dramatically improve your health? It sounds almost too simple to be true, but stick with me because the science is fascinating. It's called the roof press. All you have to do is press your tongue firmly against the roof of your mouth, right behind your front teeth. I don't mean just resting it there. I mean actively pressing upward. Now, while holding that pressure, take a slow breath in through your nose for 3 seconds. Hold it for 2. Then, breathe out through your mouth for 4 seconds. Let's break down why this is so powerful. The roof of your mouth is a hub of nerves and pressure receptors. When you press your tongue there, you send a signal straight to your brainstem, which controls your body's automatic functions. This signal tells your brain to engage its calming response. This simple action also stimulates the vagus nerve, the master regulator of your heart rate and blood pressure. Activating it triggers your body's relaxation response, which lowers your heart rate and increases blood flow to your brain. This breathing pattern also creates something called respiratory sinus arrhythmia, a healthy variation in your heart rate that signals a flexible, resilient nervous system. A 2019 study from the University of Kyoto found that practicing this for just 20 seconds, twice a day, led to lower blood pressure and increased heart rate variability, a key marker of nervous system health. Participants also reported feeling less anxious and more mentally clear. Ready to try it? Sit comfortably. Press the tip of your tongue firmly against the roof of your mouth, just behind your front teeth. Inhale through your nose for 3 seconds. Hold for 2. Then, exhale through your mouth for 4 seconds. Repeat this cycle 3 times. That's it. Just about 30 seconds. Do this once in the morning and once at night. You might feel an immediate sense of calm, a slight tingling, or simply a quieter mind. The effects are cumulative, so be patient as your nervous system learns this new, healthier pattern. In Okinawa, Japan, a region known for its high number of centenarians, elders practice something similar called tongue training every morning. Researchers discovered these elders had nervous systems that function like those of people 20 or 30 years younger. Their secret? The daily stimulation of the vagus nerve through these simple tongue and breathing exercises. Now, for our second technique, which builds on the first and specifically targets blood flow to your brain. It's called the swirl and press. You're going to move your tongue in a complete circle around the inside of your mouth, tracing along your gums and cheeks. Do it slowly, pushing firmly against the tissue. Make 3 full circles in one direction, then 3 in the other. So, how does this help prevent a stroke? The pressure changes you create in your mouth stimulate your baroreceptors. These are tiny sensors in your neck's major arteries that regulate blood pressure to your brain. As we age, these sensors can become less sensitive, leading to dangerous blood pressure spikes or drops. The swirl and press technique essentially recalibrates these sensors, keeping them active and responsive. Over time, your blood pressure becomes more stable, reducing the risk of sudden spikes that can lead to a stroke. A study at Tokyo Medical University found that participants who practiced this technique daily had significantly fewer blood pressure spikes, especially during the early morning hours when most strokes occur. Let's do it together. Relax your jaw. Start at your upper right gum and press your tongue as you move it slowly in a circle across the top, down the left side, across the bottom, and back up. Do this 3 times, then reverse for another 3 rotations. The whole thing takes about 30 seconds. You can combine it with a roof press for a powerful 1-minute daily routine. You might notice more saliva, which is a great sign you're activating your relaxation response. I know what you might be thinking. How can moving my tongue really have such a big impact? Well, think about it. Your body performs millions of automatic functions every day. These tongue techniques aren't about manually controlling every single one. They're about fine-tuning the control system, your autonomic nervous system, so it can regulate everything more effectively. It's like tuning a piano so it can play beautiful music on its own. These aren't just ancient traditions. They are scientifically backed methods to help you take control of your health in just minutes a day. It's about working smarter, not harder, to support your body's incredible, natural ability to heal and thrive. Here's a third technique. Dr. Hinohara specifically recommended for people who've had a mini stroke or have significant risk factors like diabetes or high cholesterol. It's called the pull and hold. You're going to reach up with clean fingers and gently pull your tongue out of your mouth as far as it comfortably goes. Then, hold it there for 10 seconds while breathing slowly through your nose. I know this sounds strange, and you might feel a little silly doing it, but the physiological effect is powerful. When you extend your tongue, you're stretching the hyoid bone, a small horseshoe-shaped bone in your neck that isn't connected to any other bones. It just floats there, held by muscles and ligaments. The hyoid bone anchors your tongue and connects to your larynx and the muscles for swallowing. But here's the secret. The vagus nerve runs right alongside these structures. When you extend your tongue and hold it, the tension directly stimulates the vagus nerve. It's a direct physical activation. This stretch also opens up your throat, affecting pressure receptors called mechanoreceptors. When activated, they send calming signals to your brain, reinforcing that relaxation response. There's another benefit too. As we age, our tongue and throat muscles can weaken, leading to problems like sleep apnea, where the airway collapses during sleep. This cuts off oxygen to the brain and is a major stroke risk factor. By regularly stretching your tongue, you keep these muscles strong, reducing the risk of airway collapse. A 2022 study in the Journal of Stroke and Cerebrovascular Diseases found that elderly patients with mild sleep apnea who did tongue exercises, including this pull and hold, for 10 minutes a day saw a reduction in apnea episodes. Even more interesting, they had measurable improvement in their blood vessel function. Their blood vessels became healthier and more flexible, which is crucial for preventing clots and strokes. So, let's go over the exact instructions for the pull and hold. First, wash your hands. You can either use your fingers to gently grip your tongue, maybe with a tissue so it doesn't slip, or you can just stick your tongue out as far as possible on its own. Extend your tongue out and slightly downward. You should feel a stretch at the base of your tongue and under your chin. Don't force it to the point of pain, just a definite stretch. Hold this for 10 seconds while breathing slowly through your nose. Then release, relax for 5 seconds, and repeat 2 more times. That's a total of 3 holds. The whole thing takes less than a minute. You should feel a stretching sensation under your chin and at the back of your tongue. Some people feel a slight tension in their neck, and many notice their breathing deepens automatically. You might also produce more saliva, which is a great sign of that parasympathetic activation. Interestingly, there's a cultural practice in parts of rural Japan called shitagaru kai, or tongue out spirit shout. Elders stick out their tongues as far as possible and make a loud sound. To outsiders, it looks funny, but they say it clears the spirit and strengthens life force. Physiologically, they're stimulating the vagus nerve and engaging throat muscles. When Western researchers measured their heart rate and blood pressure before and after, they found significant improvements. It's a powerful nervous system reset. You don't have to shout when you do the pull and hold, but if you're alone, try humming while you hold your tongue out. The vibration adds another layer of stimulation. Now for the fourth technique, which is so subtle you can do it anywhere, anytime. It's called the tongue float. Throughout your day, just check the position of your tongue. For most of us, it rests flat at the bottom of the mouth or pushes against the lower teeth. This is a collapsed, low-energy posture. Instead, you want to train your tongue to rest in a neutral elevated position. The entire body of your tongue should be gently suctioned up against the roof of your mouth, with the tip resting lightly behind your front teeth. It should feel like it's floating upward. This might feel strange at first, but over time your muscles will adapt, and it'll become automatic. Why does this matter? Because this position maintains a baseline level of vagus nerve stimulation all day long. It's like keeping a pilot light burning. It also supports proper breathing through your nose. Mouth breathing is linked to inflammation and higher stroke risk. Nose breathing, supported by proper tongue posture, filters the air and promotes better oxygen exchange. This posture even improves your head and neck alignment, reducing muscle tension and improving blood flow to your brain. A physical therapist in Osaka, Dr. Yuki Tanaka, taught this to his elderly patients. He found that those who maintained this tongue position had better balance, fewer headaches, and more stable blood pressure. So let's practice the tongue float right now. Check where your tongue is. If it's low, gently lift the entire surface against the roof of your mouth, creating a light suction. The tip should be just behind your front teeth, not pushing them. Your teeth should be slightly apart, and you should be breathing comfortably through your nose. Just hold this position for as long as you remember. When you notice your tongue has dropped, just lift it again. The goal is to retrain your default position. In the beginning, you might need to remind yourself often. Set an alarm or check your tongue position every time you stand up or finish a task. Over a few weeks or months, it will become your new normal. You might notice you're producing more saliva at first, and your breathing may feel easier and deeper. Many people report feeling more alert and less mentally foggy. Some even see a reduction in tension headaches. Now, you might be wondering, can I do these techniques if I have a medical condition or I'm on medication? The answer is yes. These are natural physical exercises that work with your body's own systems. They don't interfere with medications. Think of them like stretching or walking. They support your overall health. Of course, if you've had a recent stroke or have nerve damage that affects your tongue movement, please talk to your doctor or a speech therapist first. They might need to modify the techniques for you. For everyone else, they're completely safe. Your body self-regulates. If you press too hard, you'll feel it and stop. There's no risk of overdoing it. Remember, these 4 techniques, the roof press, the swirl and press, the pull and hold, and the tongue float, are most effective with consistency. It's not a one-time fix. Your nervous system needs regular input. Think of it like exercise. 10 seconds a day is vastly better than nothing. 1 minute is even better. And 5 minutes a day, using all 4 techniques, will give you the maximum benefit. Even if you only remember to do one technique once a day, you are making a positive impact. Thanks for watching. I hope these techniques bring you calm and better health. Don't forget to like and subscribe for more tips.
Now, before you rush off to start these techniques, there are 3 critical mistakes I need to warn you about. These are things that well-meaning people do, thinking they're helping themselves. But they're actually increasing their stroke risk or undermining the benefits of what we just discussed. The first mistake is aggressive neck stretching and manipulation. You've probably seen people cracking their necks, rolling their heads in circles, or having someone forcefully manipulate their cervical spine. While gentle stretching is fine, aggressive manipulation of the neck, especially quick twisting or cracking, can be dangerous for seniors. The arteries that run through your neck can be damaged by forceful manipulation. In rare but documented cases, this has caused a tear in the artery wall, leading to a clot, which can then cause a stroke. I knew a woman, let's call her Margaret, 71 years old, who went to a massage therapist for neck stiffness. The therapist performed a strong, twisting manipulation on her neck. Margaret heard a pop and felt relieved for a moment. 2 days later, she experienced severe dizziness and confusion. She'd had a stroke caused by a vertebral artery dissection. Margaret survived, but she spent months in rehabilitation learning to walk and speak clearly again, all from a neck manipulation that was supposed to help her feel better. The lesson is simple. Your neck is not something to be aggressive with, especially after 60. Gentle stretching, heat, and the tongue techniques we discussed are much safer. If you need professional help, seek out a provider who specializes in geriatric patients. The second mistake is ignoring dental health. This might seem unrelated, but it's absolutely critical. Chronic gum disease and tooth infections create ongoing inflammation in your mouth. That inflammation enters your bloodstream and damages the inner lining of your arteries. Damaged artery linings become rough and sticky, allowing plaque to form. These plaques can rupture, causing clots that can lead to a stroke. Multiple studies have found a strong correlation between gum disease and stroke risk, with some showing a 20 to 30% higher risk for those with periodontal disease. Let me tell you about Robert. He was 76, meticulous about his health except for his dental health. He had sensitive gums that bled, but he figured it was just part of getting older. One morning, he woke up with slurred speech and weakness on his right side. He'd had a stroke. Doctors explained that the chronic inflammation from his gums had likely contributed to the plaque buildup in his carotid artery. The lesson here is to brush twice a day, floss daily, and see a dentist regularly. If your gums bleed, don't ignore it. Your mouth is a gateway to your bloodstream. Interestingly, the tongue exercises we discussed actually support gum health by increasing blood flow. It's not a replacement for brushing, but it's another layer of support. The third mistake is what I call chronic shallow breathing. As we age, many of us develop a habit of breathing shallowly from our chest. This keeps your body in a low-grade fight-or-flight state, which over time damages your cardiovascular system. It contributes to hypertension and arterial stiffness. Deep diaphragmatic breathing does the opposite. It tells your nervous system that it's safe to relax. Your blood pressure drops, your heart rate slows, and your blood vessels relax. Here's a simple test. Put one hand on your chest and one on your belly. Take a normal breath. Which hand moves more? If it's your chest hand, you're a shallow breather. If it's your belly hand, you're breathing deeply. The tongue techniques we discussed naturally encourage deep breathing, but you can also practice it throughout the day. A man named James, 68, had been on blood pressure medication for 15 years. He started practicing deep belly breathing and combined it with the tongue techniques. Within 2 months, his blood pressure readings were consistently lower, and his doctor reduced his medication. He felt calmer, slept better, and had more energy. So, to summarize these 3 critical mistakes to avoid: don't aggressively manipulate your neck. Take care of your dental health as if your brain depends on it, because it does. And don't let shallow breathing become your default. Now, I want to talk about mindset. Everything we've discussed today, the tongue exercises, the breathing, these aren't just mechanical actions. They're invitations to reconnect with yourself. As we age, we can feel disconnected from our bodies, like we're just passengers in a failing vehicle. But the truth is, your body is still your ally. It's still trying to heal and balance. It just needs your support. When you take 10 seconds to press your tongue against the roof of your mouth and breathe deeply, you're not just preventing a stroke. You're saying to your body, I'm here with you. I'm listening. I'm helping. That partnership between your mind and body is the foundation of health. The famous Japanese physician Dr. Hinohara used to say the body is like a garden. You can't force a plant to grow, but you can tend the soil, provide water, and remove weeds. Your body is the same. You can't force it to be young again, but you can create the right conditions for it to function as well as possible. These tongue techniques are part of tending your garden. I know some of you are thinking about nutrition and exercise, and you're right, they're incredibly important. These techniques are not a replacement for a healthy lifestyle. They're a powerful addition to it. If you want more information about specific dietary strategies for brain health, I've put together a comprehensive guide with meal plans and recipes for people over 60. You'll find the link in the description below. But even if you change nothing else, incorporating these tongue techniques will make a difference. The studies support it, traditional wisdom supports it, and the experiences of countless people support it. You have more control over your health than you've been led to believe. Yes, genetics and luck play a role, but so do your daily choices, even choices as small as where you hold your tongue. Before we finish, I want to leave you with a challenge. For the next 7 days, practice at least one of these tongue techniques every morning and every evening. Just 7 days. It's maybe 2 minutes a day. At the end of the week, check in with yourself. Do you feel any different, calmer, sleeping better? You might notice changes, or you might not. But either way, you'll have developed a habit, and habits shape our health in the long run. If you found this information valuable, share this video with someone you care about. Leave a thumbs up so more people can find it. And comment below letting me know your age and whether you're going to try these techniques. I read every comment and I'm genuinely curious to hear from you. Tomorrow, I'm posting a follow-up video about another simple Japanese practice that takes less than 5 minutes a day and has been shown to improve balance and reduce fall risk by over 40%. You won't want to miss that. So make sure you're subscribed and have notifications turned on. Your brain is precious. Your independence is precious. You deserve to live your later years with clarity, strength, and joy. These tongue techniques are one small but powerful tool to help you do that. Don't wait. Start today. Just 10 seconds. That's all it takes to begin protecting your brain. Thank you for being here and for caring about your health. I'll see you in the next video. Until then, take care of yourself. And remember, it's never too late to start.